Good morning, everybody. Hello and welcome to the workshop. My name is Amy and I'm going to be the moderator for this webinar this morning. You can't see me, but you will hear me off and on. Today's webinar is focused on strengthening your mental health and is the second of 4 webinars as part of the Tackling the Pillars of Health COVID-19 webinar series. This series is supported by a grant from Healthy Together Now, which is a community-led, regionally coordinated, and government-supported grassroots program to help prevent chronic disease in Manitoba. Thank you, Healthy Together Now. Before we begin, I would like to introduce our presenter. Kamara Tayo-Jones holds a Master's of Social Work degree and a Bachelor of Arts and Science degree in psychology. She is a registered social worker with the Manitoba College of Social Workers and has worked in health and social services for over 22 years. Kamara has been an instructor for the University of Manitoba and provided mental health services in regional health programs. In her current role, she supports clients to manage chronic diseases, promote healthy behavior change, and improve healthy living. We will have time at the end of the presentation to answer any questions you might have, so please make sure to submit them in the questions section or chat box section on your screen. I will be monitoring both. That's all for now. Kamara, you are up.
And thank you for that wonderful introduction, Amy. And so this session today is going to focus more about what you can do. There's a wealth of information out there about different mental health diagnoses and different mental health responses. So today we're going to focus about what you can do for you or for someone else. So we're going to take a look at mental health versus mental illness, recognize the causes and symptoms of mental health. And we're also going to look at different sources of support and discuss the strategies that can help you make changes to improve your life. So mental health is a state of well-being, and we all have it. Just like we each have a state of physical health, we also have to look after our mental health. It's about enjoying life, having a sense of purpose, and being able to manage life's highs and lows. Mental illness is described as feelings of disturbance in your thoughts, your feelings, your perceptions that's severe enough to affect your day-to-day functioning. And some examples are anxiety disorders, mood disorders such as major depressive disorder or bipolar disorder. In Canada, 1 in 5 people will have a mental illness. We all have mental health and we can work at being mentally healthy. Depression is a common diagnosis for people who are experiencing a low mood that exists for or persists for longer than 2 weeks. We may experience some of these symptoms from time to time in our lives. For example, experiencing a death in the family, losing a job, or failing an exam. So talk to your family doctor about these symptoms if they prevent you from participating in work or your daily life, or if they persist for more than 2 weeks. Well, just looking at this, I feel anxious. The sweat on her forehead alone makes me feel a little nervous. So symptoms of anxiety include sweating not due to exercise, a tight feeling in your chest or chest pain, overthinking, feeling overwhelmed, difficulty concentrating or making decisions, sleep disruptions, stomach discomfort such as diarrhea or constipation, feeling like your heart is racing, feeling threatened, fear of losing control, and low energy. Again, we experience some of these symptoms from time to time in our lives. Think about the last time you had to write an exam or go on a job interview. You would have experienced some form of anxiety and then it passes. So definitely talk to your doctor about these symptoms if they prevent you from participating in your daily life or work or persist for more than 2 weeks. Stigma is when you're viewed in a negative way because of a difference, such as your mental health. Prejudice is when you're treated poorly or differently or services are denied because of this stigma, and this exists. Research completed by the World Health Organization shows that many people avoid mental health treatment because of fear of this stigma and prejudice. And that's why it's still so important for us to be able to access the services that we need, despite how we may feel. Accessing those services can mean the difference between us being mentally healthy and mentally unhealthy. Of course, we're all going to feel, or many of us, not we're all, many of us will feel like our family can't understand what's happening. Or often what I hear in therapy is something is wrong with me, and that's horrible. And we try to help people reframe that and take a look at something's not feeling right, and let's help you get the best support that you need to help you feel right again. So when we think about help and getting help for our health, if you had a broken leg, you wouldn't say, suck it up, get up and move, you should be able to do it. If you're a diabetic who is insulin dependent, you wouldn't say, I can't take this, I don't have to take this insulin, this isn't going to help me. But that's often what we hear with mental health, and that's part of the stigma where people say, just suck it up, buttercup, you can get over this, be strong, you don't need to take medication. Medication's bad for you. It's bad that you're taking this pill to survive every day. You can be stronger than that. And those words can be so harmful to us and to our loved ones when we're struggling. So remember that health and social support services are available to help manage and improve mental health. And they're throughout your community, whether it's rural or in an urban setting. If you're looking for more information on the type of mental health resources available to you, go to the Canadian Mental Health Association's website. They have a very exclusive list of all the different resources available according to your region. Medication. This is a decision made with your doctor, who can advise you on the most appropriate medication to treat your mood. Medication can help you function better and may make it easier for you to manage stress. Medication can work with therapy and support to improve your overall mental health. And so sometimes we have to take a look at what our body needs. And often it may be that our body isn't in equilibrium. We're not making the right kind of chemicals or hormones, and medication can give that what we need to help us function at our best. So what kind of help and support can we look at getting? Support, spending time with others. It helps us to stay busy. It gets us talking about our feelings and gets support from other people. We might even be able to help someone else as well. Volunteer, do an activity. It also just feels good to connect in person, online or on the phone. There are services available in the community to help support your mental health, such as support groups for those in need and support groups for their friends or family members. There are education classes to teach you more about specific mental health issues and diagnoses. During COVID, free mental health counseling is available, and more information can be found on the Government of Manitoba's COVID information website. How can you support someone with a mental health concern? It is the same as anyone with a health concern. Have a non-judgmental attitude. Ask about what you can do and be ready and available to do it. Often we'll hear people say, well, people did offer their support, and when I called on them, they didn't return my call, or they said they would show up and they didn't. So be ready and available to do what you've promised to do. Encourage your family member or loved one to access services or support if they haven't already done so. And of course, be available to listen without any expectation to act. Sometimes just sitting together quietly is all you need to do to help a person, because it's helping them to be seen, to be validated, and to be valued. To therapy or not to therapy? That's often a question. When do I go and who do I go to? So if you have extended health benefits with your employer, you may have coverage for therapeutic services. There are counseling services in Manitoba that provide services for a fee, and some may offer a reduced fee based on your income. Therapy costs may be considered a medical expense on your income tax return. Therapy offers a variety of strategies to help you learn about and manage your mental health and your family members' mental health. It can improve your communication skills. It can help you understand what leads you to behave in certain ways and learn about different ways to change your behavior. Learn and practice different coping strategies. Problem solve. Understand other perspectives. Therapy can help you repair relationships and heal from past hurts. It can help you improve your quality of life, which will lead to improvements in your relationships and/or your career. But therapy is only as good as the relationship between you and your therapist. It has to be a good fit, as you need to trust your therapist with your most vulnerable thoughts. Therapists are trained in different models of treatment. You'll find therapists among social workers, psychologists, marriage and family therapists, certified counselors, occupational therapists, some doctors, psychiatric nurses, and those are just some of the professionals who may have training to provide therapy. If you're interested in seeking therapy, ask for a referral from your family doctor or from friends or family who've had good experiences with therapists. And of course, you can always come to Wellness here. We have our own therapeutic team as well. So now we're going to move on to the section where we talk about helping yourself. And we're going to focus on stress and how stress affects us and what we can do to manage stress or cut it out of our lives. There are changes you can make on your own to help improve your ability to cope with and manage stress in your life. Stress is an emotional response and a physical response to a situation, and it's normal. It's an expected part of life. Good stress, like moving, going on vacation, having a baby, and bad stress, an argument, fear, getting in financial worries, loneliness. We all have a different way to deal with stress, and the way we think about stress will affect how we feel about it and will affect how we behave. Think about the different things that cause stress in our lives. Right? Whether it is walking past a car exhaust and we smell those stinky fumes and it gets us upset, or we're ill or unable to do something that we are used to doing. What about your home environment? You know, is your home environment a stressful place for you? Is there job and financial stress? Changing roles in your friends and family? What about your own perception of yourself, your sense of control and your self-worth, right? What about grief? Feeling like you're losing control, control of your emotions, control of your abilities, you can't control your routine. All of these things can create stress in our lives. So when short-term stress is effectively managed, the body returns to its normal state of equilibrium. And that means that we're feeling balanced. But if stress persists, the body continues to produce extra stress chemicals called cortisol. Over time, as the body goes on trying to adapt under increased stress, health problems such as high blood pressure and heart disease can happen. Persistent stress can worsen existing illness, such as anxiety, depression, and asthma. So we focus on how you can help yourself by being resilient. Resilience is the ability to adapt to life's changes by coping with these changes in helpful and meaningful ways. And when we think about coping, we think about the things that we can do to rebuild our quality of life, to reduce discomfort, to maintain our sense of self-worth, and things that allow us to adjust and manage our health. So when we talk about stress, first thing is cut it out. If you can't cut it out because it's related to family, work, or other parts of your life, then try boundaries to help you. Boundaries are limits that we put in place to ensure we or others don't ask more than we have to give. For example, after a long week at work, a friend asked you to come over for a movie night on the weekend, and that might mean a late night, and you may not have the energy to do this. In the past, when you did go, you noticed that you did not rest well, you did not prepare for the next work week, and you started the week tired. That one night out was felt for many days before you felt rested again. An effective boundary would be to limit how late you stayed out, to limit your alcohol consumption, limit how often you go out on the weekend after a busy work week. Sometimes people will say, well, I don't want to say no. I don't want to turn away my friend. And I'll say to you, you need to make decisions about what you can give and how best you can give it. And a true friend would recognize that your health comes first. And there are other times that you can connect with them. This isn't that you have to give up every weekend. It just means that when you need it, you need to recognize that you need it and take that time. Changing the way that we think sounds so easy, but not always so straightforward to do. We all have different ways to deal with stress, and the way that we think about stress will affect how we deal with it. Positive thoughts can lead to positive feelings, which can influence us to make positive behavior choices. Let's look at this example. This is too much. I can't do it. What are the usual feelings associated with this kind of thinking? Well, I have a sense of failure. I feel like I'm worthless. It's hopeless. I can't ever do anything. And so those negative emotions reinforce our thoughts and make us feel like we shouldn't even try. But if we change the way that we think about it and maybe say, this is difficult. I've done similar things like this before, and even though it feels hard, I can do this because I've done it before. I know I can do this. Now you're feeling hopeful. You're feeling maybe not 100% capable, but more capable than if you thought, I couldn't do this. And you're more likely to act on it, to try it, to engage in some way with whatever it is you're trying to do and to be successful as a result. So taking care of yourself is different for everyone. And so we can talk about the way that we think and the way that we feel and how it changes our behavior, but then we can also look at what do we do for ourselves that helps us to feel better. And those hormones are so important because self-care actually makes us create the right kind of hormones to help improve our mood. And that is part of being mentally healthy. Taking care of yourself is different for everyone, and sometimes it means that a massage or a pedicure is what you need, and for others, it's decluttering or catching the sunset. Whatever you choose, self care activities help you feel calm, connected to something or someone, and in control. It's a way for you to invest time in meeting your own needs. It is intentional and will boost those feel good hormones. So let's look at those feel good hormones. Serotonin helps regulate your mood and can help you stay focused and feel happier and calmer. Serotonin improves your memory and ability to learn. It also helps to regulate your appetite. 10 to 15 minutes exposure of sun outdoors if you're able to. And if you're unable to go outdoors, polar vortex and all, -50, then you can sit by a window for direct sun exposure. It might mean that you have to sit by the window longer because our windows are usually coated with low E argon. I think that's what it's called. That blocks out some of the UV light, but you can still get some. And so think about the kind of activities that you do. Think about going for that walk outdoors if you can bundle up and manage it. Think about doing things like meditation. Those things help you stay focused, feel happier, calmer, and regulate your mood. Dopamine. This is the feel good hormone. It is the reward chemical. How can you get dopamine? How can you make dopamine in a safe and healthy way? Well, protein. Foods that are rich in protein will give you a boost of dopamine and help your body make more dopamine. Think about feeling successful. Think about the last time you completed a task, you challenged yourself and did something, and how good it felt. The last time that you celebrated with people, whether it was New Year's or if you were in lockdown a long time ago. But think about how that feels when you're celebrating. It's a good feeling, and that's because you've got the right kind of hormones coursing through your blood. Oxytocin. So, this is the love hormone. and it can increase with hugging, cuddling, and other feel-good activities. It's involved in relationships with trust, empathy, and good connections. So if the things on this list here, if you look at them and you think, I haven't done these things in a while, this might be something for you to start working on and adding some of these to your life. And of course, endorphins. Endorphins can relieve or reduce pain and stress. They can also help you feel happier and calmer. Think about it. Get moving. Listen to, read, or watch comedy. Do something fun and interesting. And yes, dark chocolate's on the list. So go ahead and enjoy some endorphins. It will help you. It will help improve your mood. Try and add all of these suggestions consistently as part of your daily routine in some way or another. Sleep. There's so much information out there about sleep, so I'd encourage you to think about sleep and how it affects your mental health. Sleep is connected to attention and reasoning skills. It helps us to process information and be more flexible in our thinking, which helps us problem solving. It can help us make good decisions, right? When we control our thinking, we are more likely to respond instead of reacting to situations. And this also helps us to achieve our goals by resisting temptation and controlling our emotions and behavior. So you can improve sleep by following a sleep routine to help you get ready for bed. As well, you can try meditation and other relaxation strategies to help you return to sleep if your sleep is interrupted. And we'll go into that a little bit more in a bit. So if you're thinking about making changes in how you take care of yourself, you can try setting some goals. Organizing and managing your time can help you stay motivated and reduce or avoid procrastination. Often, when we're stuck and unable to do something, it may be that what we want to do seems overwhelming. So try breaking it down into smaller steps and setting up a plan to help you manage each step. So, for example, if you're interested in trying meditation, you could set a goal to meditate each day after lunch for 5 minutes. This is part of your self care to improve your mental health, and setting a plan can help you to achieve this. If you want more information on SMART goals, you can find this easily available online with good directions on how to go through each stage of setting this goal. So, relaxation. Why relaxation? It's a good way for us to channel our energy, focus, improve our concentration, and calm ourselves. Pick a quiet place. Minimize your distractions. Remember to breathe. Focus on one thought, one place, one event, one thing, but one thing only, and practice daily, right? Some people say, well, when I relax, I get distracted. Well, if you get distracted, it's okay. Just come back to what it is that you're doing, very much like meditation, which we'll get to soon. Deep breathing. It's an effective coping strategy for stress. It helps you to relieve tension and take control. It's starting with the air that you breathe. Try breathing through your nose or pursed lip breathing. What's that? Purse your lips like you're breathing through a large straw. And it helps you control how much air is coming into you. And that's important because if you're taking these deep breaths, you can run the risk of hyperventilating. So if you want to control your breathing, try breathing through your nose or pursed lips and see if that can slow things down for you and help you feel more in control. Progressive relaxation is very much deep breathing with a focus on relaxing and tensing different parts of your body. And so you can work head to toe or toe to head. But basically, what you do is you tighten the muscle group while you breathe in, and when you breathe out, you release that tension, and you should feel that muscle group relax. And as you do that, you're working through your body, relaxing and tensing muscles. So you can start at the top of your head, squeezing your face, breathe out, move down to your shoulders, squeeze your shoulders tight, take a deep breath in and breathe out, relax, and keep moving down your body until you reach your toes. And that's just a way to intentionally release tension within your body. So, mindfulness and meditation is a way for you to take control of your state of mind. It encourages deep concentration, clarity, and calmness. It takes as little as 5 minutes a day. What is mindfulness? It means that you're paying attention to what you're doing in the moment. How many times have you um, driven your car home and asked yourself if you stopped at that stoplight or that stop sign, or if you ran it, and you're not quite sure? You weren't being very mindful when you were driving, and we all do that. We're thinking about dinner or a phone call we have to make or getting laundry done, whatever, but we're distracted in what we're doing. And so mindfulness means in that moment, you're going to pay attention to what it is that you're doing, right? And that what you're doing is meditating, focusing on that single object, feeling, vision, even a chant, as long as you have a point of focus. Quiet your thoughts. And it's okay if you stray, and you will stray like everybody else. Recognize that you strayed, return to your focus, and continue. And sometimes you can do this for as little as a few minutes, 5 minutes, to help you settle down before bed. Or if you've had a particularly difficult day, you just take 5 minutes to just compose yourself, find some control, feel some calm, and then you're up and ready to go for the rest of your day. Visualization. This is my favorite thing. When I wake up in the middle of the night, this gets me back to sleep so quickly. It's similar to a guided daydream. It very much is a meditation, a form of meditation. It refocuses your mind. You think about a mental picture. So I'll say, what's the happiest thing that you can think of? Person, place, event, and I always use the beach, right? And so when you visualize that, wake up your senses. When you wake up your senses, you're going to be focused on one thing only. So if you think about your happy place, person, or event, what does it look like? What does it feel like? What does it sound like? What does it smell like? What does it taste like? And then at the end of that, what are all those feelings that you're feeling? And it's usually calm, happiness, peace, control. And that can help you quiet yourself to go back to whatever it was that you were doing. In my case, it's usually go back to bed, right? And if I don't do that, I tend to stay awake and my mind starts to wander. But with visualization, I'm able to quiet everything and calm myself so that usually I fall asleep before I even get to the second sense. So you can try that absolutely on your own. So, our take home messages today: mental health is a state of well being, and we can care for our mental health just like we care for our physical health. Stress can control your body, but you can control stress by making a number of lifestyle changes to better cope with your situation. And if that's not enough and you need more, there are supports and services available to help you manage your mental health. The best place to start is to find more information online at the Canadian Mental Health Association. And if you think you're ready to consider therapy, other support services that require referral, or even medication, you can talk to your family doctor or reach out to any of the mental health support services and they will point you in the right direction. All right, so this is a good time to take that break, take that deep breath, and go for questions.
So yeah, if anyone does have any questions, please make sure to put it into the chat box or into the question box. You're all paying great attention, so I know that we might have some burning questions we want to ask. Oh, here we go. If someone wants more information on counseling services at the wellness, where is the best place to find this information? So like, do they need to be referred?
So you can call the Wellness Institute, the rehab clinic, and they will put you through to me for more information. And I can either email you information, or if you're interested in therapy, we'll take a look at what your situation is and see which of our therapists is most suitable for you.
And the phone number quickly is 204-632-3910.
You got it.
Anyone else have any other questions for Kamara? I have a question here. Can you go back to the cortisol slide? I missed a few of the effects.
All right, let's take a look. Let's see if it'll let me do this. It just might not. Yeah, it's not letting me go back. Give me a moment here. I'll get to it. I don't know why it won't let me. This happens so often. It's on a pointer, that's why. There we go. There we go. Got it. This one? There. Any specific questions about this slide?
It just says that they missed a few of the effects.
Okay.
So cortisol slide, is this it?
Yep. Is it showing? Okay.
Yeah. Okay, we have another one. I'm interested in therapy, but I'm wondering how effective it will be since I'm currently studying to be a mental health care professional and I've peeked behind the curtain, so to say. Can you tell me anything about the experience of mental health care practitioners seeking therapy themselves?
That is a fantastic question. Oh my goodness. And so I've had these conversations with many of my colleagues. And so depending on where you're situated with your employment, there may be additional services for you as a mental health practitioner. Oftentimes that stigma, that fear of it affecting your work and affecting people's perception of your abilities to provide the job, that's real. And so if you're having mental health issues, then you have to be concerned about whether or not you are an appropriate mental health practitioner at that time, and if you need time off, or maybe to focus your skills on very specific mental health work. And so what I do suggest that you do is find a therapist that you know, that you trust. For myself, I've had my coworkers will come to me and we can do work together, or I can refer them elsewhere if they're looking for something more. But what I can say to you is the one thing that will do the most harm is if you do nothing. And so reach out to help wherever you can find it. If you're looking for very confidential, discreet services away from your workplace, there are opportunities available. And if you go to a private therapist, that might be a good indication there for you. Or if your employer has a family therapy program available to you through employee assistance programming or through a private referral as well.
Great. Okay, another question. How can I really figure out things that relax me and help me to de-stress? So, for example, I sometimes feel like watching TV for hours will help to relax me, but after a while, I'm tired of that too, and I feel like it didn't really help.
Right. So watching TV is a form of distraction. That's it. Unless you're watching comedy, because if you're watching comedy, then you're helping yourself with those wonderful, um, wonderful hormones that we talked about, right? Um, there we go, the endorphins, right? That laughter is so important. And so um, TV is not a relaxation form, is not a good form of relaxation. It's just a way to relax before you get busy into doing things. So if you need something different, then the only way to figure out if it works for you is trial and error. Some things may work, some things may not. And there's a lot of information here today, folks. So if you see something that is interesting to you, that's where you should start. Under no means are we expecting you to try all of these at the same time. But these are options for you to try to see what works for you and what doesn't. Like I said, with the visualization, I could use that to help me get back to sleep in the middle of the night. It doesn't always work. Sometimes I have to get up and go for a walk, or do something different to make myself tired, like reading the vacuum cleaner manual, right? But you need to try something for yourself. So the easiest answer, straightforward answer is trial and error.
Great. I just wanted to answer one question that I think is good for the whole group. I'm going to share this webinar, or we're going to share this webinar on our website after, so you can share this with family, friends, and they can rewatch it. So I'll go over that at the end. Another question I have, it seems when I'm rushed or stressed, I get lower back pain.
Yeah. And so pain is a symptom of stress. Stress can be a symptom of pain, right? And so when you think about being stressed and finding that pain, it could be that you're moving so quickly that you're pinching nerves. It could be that you're moving so quickly because you're stressed, or you're not focused on what you're doing, that you're actually harming yourself. And so think about shoveling the walk and shoveling very quickly because you're in a rush to get to work, and you're lifting that heavy snow and you're not lifting with proper form, and you're turning and dumping that weight, and then you're going to feel that pain. And so absolutely, if you were to take your time and do it properly, you would be less likely to feel that pain. So pain is a good way to indicate that you need to stop what you're doing, take a deep breath, slow down, refocus your energy, and do what you're doing mindfully. If pain persists and it becomes so strong that it's preventing you from doing what you need to do, then you may need to get that checked out. It may be more than just a psychosomatic or stress induced. There may be an underlying medical issue there.
Great. I have a professional question here. How can someone professionally provide comfort to a patient dealing with depression? She states some patients are simply walk-in who are clearly are trying to reach out but may not have the extended time to attend to their concerns as we are appointment based. And then others are longer stay patients who may have extremely hopeless thoughts.
So it depends on what professional realm you're talking about. If you're a medical doctor, a family doctor, and this is your patient, then you have a duty to act accordingly. If you're in an allied health setting where providing mental health support is not really part of your job description, then we can go back to how you can support a person by listening, validating their emotions, validating their experiences, talk to them and refer them elsewhere. If you think that someone is in need of more support than you can provide, certainly connect them to a social worker. It is our job to connect people with resources. It is part of our education and training to provide counseling, and for those at a master's or higher level to provide specific forms of therapy. So you can certainly reach out to us. Social workers are involved in many community offices at the wellness. I'm the only social worker here. And so you can certainly call a social worker to ask for direction, and they will put you into connection with the right resources.
I just got info here that this person is allied. They are a technologist in the diagnostic imaging department. So
All right. Well, okay. So thank you for more information. That certainly helps. As Allied Health, you have a requirement to provide care and services to your patient. As you know, in diagnostic services, you don't have the time and are certainly not equipped with the supports to provide mental health services. And so your best option is to listen to the person, let them know that you take their concerns seriously, and to make a note of it to send it to whomever is the referring um, practitioner. So, whatever consult came into you to do the diagnostic imaging, you can send that back with your concerns as well, so that the referring agent knows that there are issues there.
great. She says, perfect. Thank you so much.
You're very welcome.
Another question I have here is, do you have specific websites or literature that you would recommend for help with time management skills?
So I referenced that SMART goal, and I would suggest that you start there. That's a good way for you to practice identifying what it is that you want to work on and then follow that process to work on it. I could give you an entire single session on SMART goals and what to do and what not to do. You can find this online. And I would suggest having a friend that you can talk to about this or a group of people that you can bounce your ideas off of. Um, Doing a SMART goal might seem straightforward at the beginning, but I'll tell you, start small. Take a look at what your goal is and break it down into small, achievable steps. If it's time management, then you need to establish a routine. You need to have blocks of time to help you be productive. That's not to say 45 minutes or, 10 minutes. It could just be 2 hours so that it's flexible. This is a 2 hour block of time, and today I don't feel like doing anything physical, so I'm going to sit and sort through my mail. Tomorrow I am feeling active and I want to go and declutter a room. So I'm going to take my 2 hour block of time to go and do just that. And so start small. Pay attention. If you feel that you're stalling, it might mean that you need to reinvent your goals or to reestablish them. Take a look at what's not working. When you see failure, don't run from it. Don't feel ashamed. Take a look at it as an opportunity to learn. This is you making a mistake so that you can learn from it and move on from there, right? And so just keep going on whatever it is that you're working on and talk to someone about it so that you can get a different perspective. Oftentimes, we might be working so hard on something that we can't see what's staring us right in front of our face. And then a friend comes along and says, well, did you try this? And you go, oh, great. Now I can try that. Why didn't I think of that? And it works perfectly fine. So start small, but get started anyways. And definitely go online, Google SMART goals, and you'll see quite a bit of information there.
Fantastic. So I don't have any more questions in the question box. Is there anyone that has a last minute question they want to quickly type in there? Okay, so I don't think so. So I'm going to wrap up. Oh, just thank you with a smiley face.
Oh, you're welcome to all of you. Um, to all of you, thank you very much for your attention today, for taking time out of your busy day to hear what we had to share today. And I do ask you that if this seems overwhelming, if there's a lot of information here, just pick one thing that you want to try doing and start there.
Perfect. So a big thank you to Kamara for a great presentation. I also want to thank the Wellness Institute and the Healthy Together Now grant for making this possible. And this recording of this webinar will be found on our website at wellnessinstitute.ca/webinar. So take a peek there to be able to watch it again. Thank you so much and take care and stay safe, everyone.